The following video is an assignment I turned in for undergrad. It's for a class called Nurse 165, Hospice and Palliative Nursing Care. It's a GE Area D class, and so that was an ethnicity and race graduation requirement. A part of the assignment was asking to take an ethnic group or other minority group and to then speak on hospice care, as well as just a general culture of the group itself, and to elaborate nursing considerations for. I made my presentation on veterans and the military culture itself as its larger scheme. And then within that, I talked about groups within that umbrella, if you will, to then dispose of nursing considerations for. A part of this assignment was essentially going through the literature and just an experience with what it takes to do a bit of a literature review. I think the video is just okay, and I think I got nearly full points on this assignment. I think my literature review in hindsight and retrospectively is just okay. I think it could be better, more cohesive. But hey, I am wanting to post this assignment in public because I think it's important to show the path of what it takes to be, say, an academic weapon, right? To do education and to actually engage with literature and research, even if it's imperfect. And I think it's important to show that progress because that is evidence of growth and in itself evidence of effort. So the rest of the video will be just the assignment that I turned in. Thank you. Taking data from the Department of Veteran Affairs, Catherine Schaefer of Pew Research Center 2021 reports around 19 million U.S. veterans in America. Of this demographic, Gulf War era veterans now account for the largest share of veterans in the U.S., surpassing Vietnam War era veterans. And projections from the VA suggest that military experience in the U.S. population will decline, and that the amount of living veterans in the U.S. will continue to decline over the next 25 years. Finnegan and Randall's 2022 recognize a different type of help-seeking behavior from veterans. Veterans often bottled up their feelings, harnessed by a military culture of stoicism and self-reliance, and the fear of sharing personal stories to healthcare professionals may have felt like a burden. A nursing consideration for military veterans is a careful conversation not meant to impede on their privacy while retaining their independence and respecting them. This is a quality of cultural competency, acknowledging the self-reliant, stoic nature that military life can instill into these veterans. When they leave military careers and are now back into civilian roles, there is this sense of purposelessness and less driven mission, and that perhaps can lead to social isolation if not carefully articulated and creating support systems around. Research relating to the care of veterans while considering their family suggests an importance on having shared decision-making with the family. This family-centered care when working with military veterans. Family members play an important role in veterans, and nurses should strive to involve those members together so that they can provide education and support one another. Speaking on end-of-life care within veteran/military culture, Veteran Affairs uniquely allows curative treatment with hospice care. In a qualitative study, Haverhals et al. 2019 suggests that this is not a delay tactic, but a transitional tactic for veterans and healthcare providers. Examining the processes influencing this type of hospice care, Haverhals and others identify that this is allowing for sustained hope and maintaining relationships with VA clinicians, easing the veterans' transitions to hospice, and maintaining cooperation, coordinating the care between both parties. This does make it an interesting conversation of hospice, though, because two things are happening at the same time, which is an attempt to treat the symptoms and be curative with cancer patients,
while also suggesting that they are in the marginal decade of their life. So it's unclear of the larger ramifications of this type of hospice care as done by the VA. This view, however, conflicts with Lee et al. 2017, looking at retrospective chart review and survey data from veterans who died from October 2009 to September 2014. Their view in the results of their study is Black veterans being less likely than white veterans to receive chaplain visits, and Hispanic veterans being less likely to receive chaplain visits and bereavement contact. This is suggesting that because of the Veteran Affairs quality of hospice care, this delayed impression of it anyway, you see minorities and ethnic groups not getting as quality of end-of-life care.
Similar to the ethnic discussion between Black and Hispanics juxtaposed to white veterans and seeing the disparity in EOL care, we see a similar disparity for female veteran use of palliative care, as researched by Valeric et al. 2021, where they find that the female perspective on this matter is not fully represented. It's not well represented in palliative care literature. Perhaps more largely, this is an implication of there being overwhelmingly more male and white veterans that creates gaps in research like this. And gaps like this are able to occur. Therefore, nursing implications can tie itself to interaction with female veterans in order to create an adherence to not only healthcare in general, but also perhaps to palliative and hospice care. Attributing to this female relationship, Stewart and Bellamy 2022 encourage healthcare professionals and nurses to take a trauma-based perspective, whether that trauma be military sexual trauma or PTSD, and this type of stress having an effect on musculoskeletal conditions as well as migraines. They have practice recommendations, such as the phrasing of questions and assessments that invite responses in an open-ended and in respectful way, in a way that's hopefully also non-triggering. They recognize the sense of stoicism and hardiness in the military culture and encourage healthcare practitioners to practice in a way that gets that open-ended approach, to not give the impression of encroaching on that independence and stoicism. Other nursing considerations is mental health disorders. Finnegan and Randall's 2022 found that post-traumatic stress disorder, dementia, substance misuse were all concerns for the veteran population. Female veterans had a higher prevalence of mental disorders than their male counterparts, and while men had a higher prevalence of PTSD. In general, the research on this topic suggests that this is an area of focus for nurses to consider. It's considering how to have the conversations around substance abuse, but also mental health, and guiding that. And in that type of education, Finnegan et al. 2020 decided to educate nurses on the topic of the culture of veterans and the veterans themselves. So they took 468 nursing students in England from two England universities, and through the survey results from didactic lecturing, found that the students perceived it as helpful, with the training being able to feel better equipped and more useful in interacting with the veteran population. This is something for nursing staff to consider about.
Grossel et al. 2017 conducted a randomized clinical trial with 150 military veterans with chronic lower back pain from a VA medical center in California. In this study, yoga classes were used as an intervention to treat these patients through pain or the Roland Morris Disability Questionnaire, assessing whether yoga treatments, specifically hatha yoga, yoga posture, regulated breathing by a certified instructor for 2 60-minute sessions in a week, would be able to produce statistically significant results. As a non pharmacological treatment, the authors of this study suggest that healthcare practitioners should consider yoga and guided yoga to help military veterans deal with chronic lower back pain. A funeral consideration for veterans who have been discharged from service, died on active duty, or released under honorable circumstances, honorable conditions, is military funeral honor. Military funeral honor has 3 elements to it: the playing of the taps, folding of the flag, and flag presentation. Flag presentation could be to the spouse of the family, children, or perhaps relatives and friends as requested. This is a formal ceremony conducted by the military to honor those who have been able to serve the country.